Welcome to Relax and Learn Medical with 432 Hz music. It may help you retain the information more quickly. Today's topic is the muscles of the legs. Our legs carry us through life literally. From walking and running to jumping and balancing, the leg muscles are complex and brilliantly designed. Whether you're a student, a professional, or a curious mind, let this be a relaxing and inspiring journey into the incredible world of leg muscles. Here are over 140 medical terms and definitions for the muscles of the legs. Major muscle groups of the leg. Quadriceps femoris, four-part muscle group on the front of the thigh. Rectus femoris, part of the quadriceps, flexes the hip and extends the knee. Vastus lateralis, lateral quadriceps muscle, extends the knee. Vastus medialis, medial quadriceps muscle, extends the knee. Vastus intermedius, deep quadriceps muscle, extends the knee. Hamstrings, group of three muscles at the back of the thigh. Biceps femoris, part of hamstrings, flexes knee, extends hip. Semitendinosus, hamstring muscle, flexes knee and extends hip. Semimembranosus, deep hamstring, flexes knee, extends hip. Gluteus maximus, largest glute, extends and externally rotates hip. Gluteus medius, abducts and stabilizes the hip. Gluteus minimus, deepest glute, assists in abduction. Tensor fasciae latae, stabilizes the hip and knee via IT band. Iliotibial band, IT band. Thick fascia helps stabilize the leg. Muscles of the lower leg, gastrocnemius, calf muscle. Plantar flexes foot and flexes knee. Soleus, deep to gastrocnemius, plantar flexes foot. Plantaris, small calf muscle with long tendon. Tibialis anterior, dorsiflexes and inverts the foot. Tibialis posterior, inverts foot and supports arch. Peroneus longus, everts foot and supports arch. Peroneus brevis, assists in eversion of the foot. Flexor hallucis longus, flexes big toe. Flexor digitorum longus, flexes lateral four toes. Extensor hallucis longus, extends big toe. Extensor digitorum longus, extends four toes. Popliteus, unlocks the knee during flexion. Fibularis tertius, dorsiflexes and everts foot. Deep hip and pelvic muscles. Iliacus, flexes the hip, part of iliopsoas group. Psoas major, deep hip flexor, joins iliacus to form iliopsoas. Psoas minor, weak hip flexor, absent in some people. Piriformis, externally rotates hip. Gemellus superior, lateral rotator of the hip. Gemellus inferior, assists in external rotation. Obturator internus, externally rotates thigh. Obturator externus, rotates thigh laterally. Quadratus femoris, lateral rotator of the thigh. Muscle actions and descriptive terms. Flexion, decreasing the angle between bones. Extension, increasing the angle at a joint. Abduction, movement away from the body's midline. Adduction, movement toward the body's midline. Rotation, turning around an axis. Medial rotation, internal rotation toward midline. Lateral rotation, external rotation away from midline. Dorsiflexion, pulling toes toward shin. Plantar flexion, pointing foot downward. Inversion, sole of foot turns inward. Eversion, sole of foot turns outward. Isometric contraction, muscle contracts without changing length. Isotonic contraction, muscle changes length during contraction. Concentric contraction, muscle shortens under tension. Eccentric contraction, muscle lengthens under tension. Microscopic and muscle fiber term. Sarcomere, basic contractile unit of muscle. Actin, thin filament in muscle. Myosin, thick filament in muscle. Myofibril, contractile fiber in muscle cells. Fascicle, bundle of muscle fibers. Motor unit, nerve and all fibers it controls. Neuromuscular junction, nerve-muscle communication site. Acetylcholine, neurotransmitter in muscle contraction. ATP, adenosine triphosphate, energy source for muscle movement. Muscle spindle, sensory receptor that detects stretch. Golgi tendon organ, senses tension to prevent damage. T-tubules, help transmit action potentials inside muscle. Sarcoplasm, cytoplasm of muscle cell. Myoglobin, oxygen-storing protein in muscles. Clinical and diagnostic term. Strain, muscle or tendon injury. Tear, complete or partial disruption of muscle fibers. Spasm, sudden involuntary muscle contraction. Cramp, painful muscle contraction. Compartment syndrome, increased pressure in leg compartments. Shin splints, pain along tibia due to overuse. Achilles tendonitis, inflammation of Achilles tendon. Tendinopathy, chronic tendon disorder. Hamstring pull, strain in back thigh muscles. Quadriceps rupture, tearing of quadriceps tendon. Atrophy, loss of muscle mass. Hypertrophy, increase in muscle size. Fasciculation, Visible muscle twitch. Electromyography, EMG, test for muscle electrical activity. Myositis, muscle inflammation. Muscle innervation term, sciatic nerve. Major nerve innervating the posterior leg. Femoral nerve, innervates quadriceps and anterior thigh. Obturator nerve, innervates inner thigh muscles. Tibial nerve, innervates posterior lower leg. Common peroneal nerve, branch of sciatic, lateral leg. Deep peroneal nerve, anterior leg muscles. Superficial peroneal nerve, lateral leg muscles. Saphenous nerve, sensory nerve in medial leg. Lumbosacral plexus, network of nerves for lower limb. Motor neuron, nerve that activates muscle fibers. Support structures in fascia lata, deep fascia of the thigh. Crural fascia, deep fascia of the lower leg. Intermuscular septa, separates muscle groups. Aponeurosis, flat tendon-like sheet. Retinaculum, band holding tendons in place. Tendon, connects muscle to bone. Ligament, connects bone to bone. Bursa, fluid-filled sac to reduce friction. Synovial membrane, produces joint fluid. Achilles tendon, connects calf to heel bone. Bonus anatomy terms grouped for learning. Origin, where a muscle begins. Insertion, where a muscle ends. Bilateral, both sides. Unilateral, one side. Proximal, closer to torso. Distal, farther from torso. Anterior, front. Posterior, back. Lateral, outer side. Medial, inner side. Continuing toward 150, we've now covered 110. Here's 40 more quick definitions. Ischiocondylar, relating to the ischium and condyle. Myopathy, disease of the muscles. Hypertonia, increased muscle tone. Hypotonia, decreased muscle tone. Muscle tone, continuous partial contraction. Delayed onset muscle soreness, DOMS. Post-exercise soreness. Reciprocal inhibition. One muscle contracts, the opposing relaxes. Agonist, primary mover muscle. Antagonist, opposes the prime mover. Synergist, aids the agonist. Fixator, stabilizes a body part during movement. Cross-bridge cycling, actin-myosin interaction. Sarcolemma, muscle cell membrane. Creatine phosphate, energy source in muscle. Aerobic respiration, oxygen-based energy production. Anaerobic respiration, energy without oxygen. Lactic acid, byproduct of anaerobic respiration. Muscle fatigue, reduced ability to contract. Muscle twitch, single contraction relaxation. TREP, staircase effect, gradual increase in muscle tension. Summation, repeated stimulation increases force. Tetanus, continuous contraction. Motor end plate, area of muscle receiving nerve signal. Recruitment, activating more motor units. Spasticity, muscle tightness due to nerve damage. Flexidity, muscle weakness or limpness. Myalgia, muscle pain. Fasciitis, inflammation of fascia. Neurogenic atrophy, muscle wasting due to nerve damage. Muscle biopsy, sampling muscle tissue. Isokinetic, constant speed contractions. Dynamic stretch, active movement to stretch. Static stretch, holding stretch in place. Eccentric loading, lengthening under tension, e.g. downhill walk. Closed chain exercise, fixed foot, e.g. squat. Open chain exercise, free moving limb, e.g. the leg extension. Kinetic chain, linked body segments in motion. Trigger point, tender spot in a muscle. Muscle imbalance, unequal strength across opposing muscles. Core stability, trunk control affecting leg performance. Congratulations, you've just explored over 140 powerful terms related to the muscles of the legs, all while staying relaxed and focused. At Relax and Learn Medical, we believe learning should be calming, clear, and deeply enriching. Keep returning to this space to nourish both your mind and spirit. Don't forget to like this video and subscribe to our channel for more exciting content.